We are in a critical point of the pandemic right now. The trajectory of this pandemic is growing. In the seventh week in a row, we've had more than 4.4 million new cases reported in the last week. If you compare that to a year ago, we had about 500,000 cases being reported per week. It is time right now where everyone has to take stock and have a reality check about what we need to be doing.
Strong words from the World Health Organization nearly 16 months into this global pandemic as cases continue to grow worldwide despite mass vaccination campaigns. So how do things get turned around? Joining us now is Maria van Kerkhove. She's the COVID-19 technical lead at the WHO Health Emergencies Program. Thanks so much for being with us. Why are the numbers rising?
Well, I think there's a combination of factors of why the numbers are rising around the world. Excuse me. It isn't consistently growing everywhere around the world. There are some countries that have shown that they can control COVID, including these virus variants. But in a number of countries, we are seeing some virus variants, this B.1.1.7, which is circulating across a number of countries in Europe. It's circulating in the United States, for example. And some of these virus variants, the variants of concern, have increased transmissibility. And if we increase transmissibility, we will have more burden on the healthcare system. And if we ease our public health and social measures too soon, if we lift those measures too soon, the virus will spread. And so I think there's a combination of factors, the variants, the fatigue, and the fact that we have inequitable and uneven vaccine distribution around the world. That combination of factors 16 months into a pandemic is really puts us in a critical situation.
In the United States, we're vaccinating more than 3 million people a day. Why isn't that enough?
Vaccine alone is not enough. One measure alone is not enough, including vaccines and vaccination. What we are advocating for at WHO and with our partners is to make sure that we vaccinated those most at risk first. These are older people and these are health workers around the world in every single country. That is of critical importance. But in addition to vaccine, it's not vaccine only, it's vaccine and we have to continue with the other measures. We have to continue with our physical distancing, avoiding crowded spaces, hand hygiene, mask wearing, improving ventilation. We need consistency in the approach at national level, at subnational levels, across a number of countries. It's the combination of factors that drives transmission down. What we need right now globally is laser focus on driving transmission down. We can do this. We can do this with the tools that we have, including vaccination, but not only vaccination. Every single citizen, every single person in the United States and around the world needs to know, what do I need to do to keep myself safe? What do I need to do to keep my family safe? And if you don't know, you need to find that out, because there's so much that each of us can do. And it is critical that everybody plays their part in fighting against this pandemic.